My name is Peter Lukana Kame Simon, fourth year physiotherapy. So for today's Freaks 2, in which I was assigned to me, I was given like Pakistanism in and cardinal personal cardinal points and physiotherapy management. So let me first start with the definition of cardinal of Parkinson disease. So Parkinson disease is the chronic progressive disorder in which it affects the central, the basal nucleus of the central nervous system. So there are three cardinal points. There are not three there, but there are four. One, we have bradykinesia. Two, we have tremors. Three, we have rigidity, and therefore we have postural changes. Before I start, let me first start with the symptom. How does it occur with the rigidity? So rigidity like cockwheel and the lead pipe. These are the symptoms. Another one, decrease in ability to move easily. Two is the active movement of a mental, concentration, emotional, and stressed may be all in the increase in the due to rigidity. Then increase in the energy expenditure, which also like one of the most affected part of the patients. So due to that, you find out that the patients might be affected with what? Rigidity. Now, another one we are going to talk on bradykinesia. Bradykinesia is the one whereby you find a whereby the patient is having hypokinesia, reducing the movement, akinesia, absence of a partial immobility, then a reduced in spontaneous blinking and freezing episode. These are the most symptoms of which affect in the rigidity. Then we come to tremors. Tremors have pulse frequency of the 4 to 7 beats. This is normally like it's also hard for the patient. Sometimes you find like, and tremors sometimes occur during when the patient is at the rest. At the rest, you can find like patient's hands some extremities shaking. And secondly, involuntary shaking, which you can occur scalatory another part. Then to diminish the action, meaning like whenever the patient try to touch everything, the action is diminishing. Then the fourth one, we are going to look at postural instability. In postural instability, this occurs due to weakness of anti-gravity muscles and contributed to the adoption of stop posture. So one, we have abnormality of posture and the balance. Then two, we have narrowing of the base of support, which can be affected. Like these are the most symptoms which affect the patient. Three, we have sensory integrity, which affects also nothing. Two, increase in the dynamic instability, active such as like self-initiations. These are the most fourth symptoms of postural instability. Then we are going to have another. We are going to talk on management. How are we going to manage the patients who are affected, who is suffering from physiotherapy management, which is suffering from this one, which suffering from Parkinsonism. One, we are going to talk on motor learning. So the motor learning, like most especially like whenever you're training motor learning, you can use blocks or you use like cones, whereby you put from point A to point B, in which patient can be managed like to instruct the patient to work on those blocks straightly on us. Another one, you can teach a visual acuity and a dynamics. This is the most important, whereby the patient learned a lot. Two, you teach about rhythmic auditory stimulations, also more important for the patient. One, we are going to talk about exercise training. For exercise training, which exercise training can we teach for the patient? One, we have PNF techniques for rhythmic and the rotational movement. Another one, we are going to give a relaxation. For relaxation, you can give PNF, yes. For relaxation, most especially like whenever you're giving like relaxation exercises like meditations, you can give yoga. Sometimes most of the yogas are important. Like you can use Bhujangasana, most important. But most of the Bhujangasana is not that nice. You can use like Bhujangasana. You can use Bhujangasana, and then you can use block post. All the yoga so for asana can be applied, and the most important for the patients for patients who are affected with the Parkinsonism, to stretching. Then another one for flexibility. How sometimes most of the Parkinsonism disease persons who are affected, like most especially you find that the range of motion is reduced. What will you do? We need to give stretching, and secondly, we can make mobilization either whenever the range of motion is reduced, there's no movement around the joint, you can, but there's no any other negative effect in the joint, but more special like there is a constriction of the muscles, which you stretching the muscle. The other one, we are going to give resistance exercises training, whereby you give resistance exercise are the most important, which you can be help the patient like to initiate to gain weight, to gain strength for any other movement. These are the most. Then another one we can give like breathing exercises. Breathing exercises are most important, because why? The postural changes of the patients, the posture has changed, but you can still giving breathing exercise for that patient. Another one you can give like balance exercises. Balance exercise, why? Because you can try, like you can give 1 point B for a patient, like to improve the balance and coordination. Another one you can give coordination exercises. Coordination exercises are the most important. So I should stop here. Thank you very much for listening for my point. We shall meet next time. Thank you.